Hello, I'm Chris Bober, and welcome back to the Saturday Morning Recovery with Dr. Nolan Clausen of Midwest Movement. This podcast is brought to you by the Bober Academy, where our mission is to train and develop superior linemen to dominate on the gridiron. My name is Chris Bober. I'm an 8-year NFL veteran. I started games at center, guard, and tackle throughout the NFL. My mission is to get O-linemen out on the gridiron playing great football. So we are back this week. And just a quick reminder, if you're watching this on YouTube, just click the little subscribe button down there and subscribe to our channel. That'll really help us out. If you're listening to this podcast on a podcast app, just subscribe to our podcast, and that way you'll get notified of all the new podcasts that come out. And of course, on any social media, we'd love your feedback. Like, retweet, share, comment, all those great things out there. We really love to hear back from you, and especially with this Saturday morning recovery. Now, what we're trying to do is trying to get you guys movement again after a big game. Now, you could do this, of course, every day. A couple of weeks ago, we started out with a whole body routine that'll just kind of get your mobility back. Last week, we featured the hips, and that was such a great one because O-linemen, we have to have low hips to win. So that mobility is great. Now, this week, we are going to come to an area that, quite honestly, is a problem area for a lot of us big guys and, athletes in general, which is our lower back. So, Dr. Nolan, why don't you tell us kind of about the lower back and show us some things that we can do to help alleviate soreness and pain?
Yeah. So you said it, low back problems in linemen is very common because we're carrying the team on our back, right?
There you go.
Yeah. So like Chris said, we did a full body routine week 1, and then we did a hip routine week 2. So if you're having low back pain, I would love for you to refer back to both week 1 and 2 because the hips are so vitally important on getting them to move so that your low back doesn't have to be stressed all the time, right?
Yeah,
So,
Nolan, my career ended with hip injuries, right? I had, bone on bone, tore my labrum. And while I was going through the whole process of trying to get to hip surgery and get it fixed, all of a sudden my back starts hurting. And I end up getting a couple of discs in my back herniated. And it's just a kind of a chain reaction that when there's problems elsewhere, your back and your spine takes on so much of that load, right?
correct. Yep. So basically that full body routine, if you were doing these cat cows where we were just trying to get the back moving, really we're just focused on the hips moving forward and back. If you had soreness during that, or if your back is sore this morning, this is something that we would love you to start at. So you're just going to move through here 5 to 10 times, just trying to open up that range of motion. If you feel like it's all just coming from your upper back, try just thinking about a laser pointer on your belt buckle, trying to point that forward and then backwards. Okay. Now, after we've gotten that moving a little bit, this is when I like to get the foam roller out. So there's a lot of people that don't like foam rolling the back, and I kind of agree. We don't want to arch our back over the foam roller. We just kind of want to try to keep our back as straight as possible. We really don't want to arch with the low back. It puts a lot of pressure and strain on that low back, especially if it's sore right now. So we're just going to do real quick. We're leaning one side, just trying to go get those big muscles, try to get them just a little bit softer. Good.
And you're looking for those, what do you call those nuggets of pain in there?
Yeah, spicy little nuggets. Find those little spicy
nuggets.
nuggets, spend a little bit of time, soften them up a little bit, and then we're going to go into some exercises to try to relieve that. So if you've listened to our podcast before, we talking about low back and stuff, we've talked about breathing. So the first exercise we're going to do, we're just going to work on getting our breath into our belly. So we're going to put one hand on our chest, one hand on our belly. And when we breathe in, we want that belly hand to rise. And then we exhale, breathe in. We want our chest hand to be pretty quiet, just the belly hand. Good. And we're just going to do about 20 breaths, just trying to get that pattern down. When we start breathing into our belly, basically it takes a lot of the stress away from those low back muscles. Okay. So once we got that down, 20 breaths of those, you're going to grab a mini band if you have one. Otherwise, you don't need the band, but we're just going to put it around our feet. We're going to bring both knees to our chest. We're going to stretch that band, straighten the left leg, keep the right leg where it is, let go. We're trying to push our back into the ground. You're going to feel your core working. Really good. Then we're going to bring the other foot. We're going to stretch back out. So you might be thinking, this isn't really stretching, but exercise for the low back actually does more than stretching. So you're going to feel like you're doing a core workout. Well,
Yeah, you're kind
it's
of
a
activating
good,
those hip flexors there along there too, which supports your spine too.
perfect. Good point, Chris. Good. And so we're just going to go back and forth, and we're just going to go, 5 reps on each side, just trying to get that low back or those core muscles working again. Okay. After we do that, we'll go back to all four where we're just right here. We went cat cow. We're going to try to find neutral again. Then what we're going to do is what we call a bear plank. So with our toes curled under, we're just going to lift our knees a half inch off the ground. We're just going to hold here. If you have back pain, go back down, move your hips just a little bit, come back up. That corrects your back pain. And we know the good position that's going to help you control your spine. Specifically this week, I've been working with quite a few offensive linemen that are having back pain, and we'll be doing blocking drills in our office. And the one thing that we correct is they're trying to block like this, right? Butt out. We tell them to get their hips underneath them a little bit, and then we start blocking and they have zero pain. So it's a position thing. So we have to be able to get here and be able to lock those hips into a place and then be strong through it. So that's why we're doing those things.
Yeah, we
So
talked about that in our building alignment series about having a neutral or positive spine angle when you arch that back, which linemen like to do because they feel like they're rolling their hips. But when you do that and you arch your spine, that puts that's just where the back pain comes in, and you kind of are in a weaker position.
correct. Yep. And so when we're here, like really arching our back and like even doing this, these big glute muscles, they're not even involved at all. But if we can tilt our pelvis, now those glute muscles are involved. They're big muscles for a reason. Don't leave them out of blocking. Like get them in. So not a whole lot of stretching, not a lot of mobility with that, but really just exercises to stabilize the spine. Now, if you are having back pain, you're having pain that's going down the leg today, the rest of the week, it would be a really good idea to get into our office and get that taken care of, because it will progressively more than likely get worse. And we want to make sure that we can handle it right away. So,
yeah, and that's something that's different, right? At that point, you got into the nerves, and
yep,
you are now in a position to where you have an injury, and you got to get that calmed down. And
yep.
I think you can probably do that pretty easily, but you do probably need a professional to do that, right?
Yes. When I was in college, I dealt with a lot of back pain, and I would have pain going down my leg, and it'll be fine. I just need to lift more weights, it'll get better, or I just need to fight through it. And then it ended up causing me to miss quite a few weeks of football. So if I had taken care of it earlier, it would have been a much easier process, and it probably would have never have missed weeks of football. So,
Yeah, and that's kind of the point of this Saturday morning recovery, is to kind of get
yep,
ahead of that pain, right? But if you do
correct.
find yourself in a position where you have tingling or the shooting pains like that, that's where you need to see a professional. Of course, Dr. Nolan over there at Midwest Movement, he's located in Elkhorn, right there by Rick's Meats and the Godfathers, right there off 204th Street. He's a great resource for you. You can find everything you need to know about Midwest Movement, it's midwestmovementelkhorn.com. Of course, we will provide a link to that with wherever you're finding this in the captions, you're going to find a link to that. So Dr. Nolan, we really appreciate it. I know that about this time of year, people start neglecting and thinking they can get through, but a little bit of maintenance goes a long way. And hopefully you guys that are watching or listening to this, you had a great game last night, physical game. Take care of the little things and your body will last a heck of a lot longer. Right, Nolan?
Yeah. Yep. Couldn't have said it any better.
Nice. Well, it will wrap it up for us. Again, reminder, click the subscribe button on your podcast app. Please subscribe to our YouTube channel and all of our social media. Like, comment, share. Give us your feedback. If you have some questions, we're going to tag Dr. Nolan in this, so he'll see them too. Or you can reach out to him directly through all of his showings that he has out there. So that'll wrap it up for us. I hope you had a great week on the Friday Night Lights. And do these exercises, so you can get back on the field and have another great game next week. Dr. Nolan, thank you so much for joining us today. We'll see you next time.
Thank you, Chris.